In this recorded demo, we're going to walk through the EpicMD Virtual Telehealth and show you some easy ways to get started. We'll go over how and where to log in, how to see a doctor, updating your health record, viewing past consultations, and setting your preferred pharmacy. So let's get started. First of all, how and where to log in. If you go to portal.epic.md/emd/home, which is the address you see in the browser here, that will take you directly to the member dashboard here and prompt you to log in. If you forgot how to find that, you can always go to epic.md, go to sign in, and then choose Bravo. And here it will prompt you with your sign in. Of course, this is where it's signing me in now. So if you'd like to see a doctor, right on your dashboard, there's a very easy to find button here that says Talk to a Doctor. If you click this, it will begin scheduling a consultation. There's several different types of consultations depending on your convenience. And as a reminder, all of the information that you put into EpicMD is 100% secure. There's a HIPAA compliant lock at the bottom, which lets you know that all of your data is secure and protected. There's a few different ways to schedule a consultation. If you'd like to have a phone conversation with a doctor, also allowing prescriptions and diagnosis on anything you can discuss over telehealth, you can click this Schedule an Appointment here. And remember that all consultations are unlimited with your membership, so you can have as many of these as you need. You have the opportunity to schedule a consultation by video. Many people like to do this if, for example, they have a rash or something that they'd like to see a doctor look at face-to-face, but they don't want to take the trouble of driving all the way into the doctor's office. One common use for this is people adding their family members when they have sick children, and it's inconvenient for them to get out of the house, but they will need to show symptoms and things like that. So this is also a very popular way to do consultations via telehealth. If you wanted to ask a doctor for advice, not necessarily for a prescription, you can have messaging here. This is kind of like the nurse hotline. And then, of course, if you were traveling abroad and you needed to still see someone, you could use the international option. So for now, we're going to go schedule the most popular, the video consultation. The first thing that you can see across the top is that you have a progress bar that takes you through every step that you need to do to schedule your appointment for yourself. It will ask me to verify that I'm myself, and I'll continue. And then it will ask me to schedule diagnostic video and let me know that I need to have a webcam, speakers, and a microphone, just making sure that you've got everything you need in order to have your consultation. So here I'll click I understand. And then the next section it takes me is the electronic health record. Now this is important that you fill this out. You can fill it out before you have your consultation or the very first time that you have one. Every time you come in, it's going to tell you the last update date, and then it's going to ask you to certify that your information is still correct. It's important that this is accurate because just like if you were coming to an emergency room or seeing any new doctor, like in urgent care, they would need to know if you had any allergies or any health medications that you're taking that might have some kind of an impact. So right here, I've updated my health record as of June of last year, and I'll certify here that it's still correct. And then the next thing is asking for your phone number to contact you in case there's any issues or if you need any assistance in setting up the virtual telehealth consultation. And then it also captures some information. If you weren't going to use this service, what would you do? And we use this to understand how we're helping people. You can leave it blank if you want, or if you were going to go to emergency room or urgent care, you could select that and then click continue. Then it will ask you what your state of residence is. Now this is important because the laws for telehealth are different in different states, and it will also pair you with a doctor that is able to help you in the state that is your current residence. So I will confirm that this is still the same state. And then at this next stage, it'll ask me the details for why I'm scheduling my consultation. There are many different reasons you can schedule telehealth consultations. If you had a fever, if you had nausea, if you had any type of common illness, lots of things like that. For now, I will put in sore throat and difficulty swallowing. Difficulty eating food. And this is not a medical refill, and I'll push continue. And as a side note, if there are any questions about what type of symptoms or what kind of things can be treated on telehealth, those are all located on epic.md, and you can find them there. I will click continue at this point, and then it gives me the option to either have a consultation sometime in the next 2 hours, or if I want to have it sometime in the future. So if, for example, I wanted to schedule something in the next few days when I knew I had time that I could be at a computer and I had maybe a work from home day or something like that, I could schedule that here with the calendar. Or if you go within the next 2 hours, it's the first available doctor. Our usual time is about 20 minutes, so it could be a window of 2 hours, but it's usually much sooner than that. If you'd like, you can also get a text message so that you know when the doctor is ready. It will come right in and text you, and you'll know to go to your computer or your tablet and have that consultation. So I will put in my SMS phone number here, and then we also available as languages, we have English and Spanish. So that does mean that if you or anyone who's a dependent that's on your plan would like to have a doctor consultation in either language, there are doctors that can do the consultation in either language. So the next step here we have is selecting your pharmacy. If you already have a favorite pharmacy saved, which I'll show you how to do in a moment, you could add it here. You could search by zip code, and then if you want to, you can select that it's your preferred pharmacy and it will keep it for the future. So for now, I'm going to select, this is my pharmacy, and at this point, because we have unlimited consultations on your plan, it just confirms for you that there's nothing due for this consultation, which is important to know. So again, on this membership fee, you have unlimited consultations, whether they're by phone or by video or for nurse advice lines. So at this point, if I select continue, it will schedule my consultation. For the purpose of the demo, I'm not going to push that button, but this is how you would schedule your consultation by video. The next topic we're going to cover is how to update your health record. So we're back at your dashboard, and if you look to the left navigation menu, you can see Health Record. You can also click Access My Records here on your dashboard. In the side menu, tap here to expand the different items, and then go to Summary. This will pull up your health center and all of the information that you have in your health record. Now, the very first time you visit this, you'll have to fill it out. If you've already filled it out and you want to come back in and edit, you can select here to show or hide each of the sections. I'll open personal information now. Here's where you'd be able to update your height, date, blood type, and pressure if you knew it, and any of your personal behaviors that might impact your health. If you want to edit this information, select Edit Personal Information, and then it will drop down some fields that you can fill out or update depending on whether you've already completed them. Once you update them, click Save, and then that information will collapse. You can go through each section. Now I'll select Medications. Click on Show to open the menu. If you have any medications that you're currently taking, select Add Medications Record. Here you can put in any medication that you have. Maybe an allergy medication. And if you have any side effects, I'll say causes dizziness. Whether you're currently using it, yes or no, and then save. Now it's important to put any medications that you're currently taking because all doctors that are having virtual telehealth consultations will check your health record and keep that in mind when prescribing other medications to you. So for now, I'll save this. You can also put in any allergies that you have. The same, if you had any allergies, you would select Add All Medication Allergies, and you could put them there. For now, I'll cancel. And the same for your medical history. If you had any previous surgeries or anything like that, it might be helpful to add those here. If you have files from x-rays or scans that you'd also like to include, they're optional, but if you feel it would be helpful to anyone who's giving you a consultation via telehealth, you can of course add those here. And I'll mention again that any data that you add for your health record is 100% secure, and nobody but the doctor who is looking through and assisting you will have access, or anyone who needs to help you with your health record. So all of those things are secure. That's how to update your health record. Now go back to the dashboard. Another topic was viewing your past consultations. One helpful activity here is being able to go back and look at pre-recorded consultations to remember exactly what it was that the diagnosis was. Many times patients leave a consultation with a provider and they've forgotten the steps that the doctor told them, or maybe they were prescribed a medication and they forgot the ways to take the medication or some other options. So luckily, if you go into the left navigation menu and you look at My Consultations, you can view any previous history that you've had. Now, remembering that you can do either a video or a phone consultation, it will tell you the consultation type in the second tab here. So if you've had a phone consultation, you can still get a copy of it and download it. If you've had a video consultation, you can click on the video icon and you can actually re-watch your consultation. This tells you who the patient name was. It also tells you the scheduled date, and it will give you the name of the physician as well who gave you the consultation. Next, let's go back to the dashboard. Hopefully this walkthrough was helpful. We've gone over how and where to log in, how to see a doctor, updating your health record, viewing your past consultations, and setting your preferred pharmacy. If you have any other questions, please be sure to contact a member of support and they'll be able to help walk you through with any issues. Thanks so much and have a healthy day.